So for 3 to 6 months, we can now progress to feet play. So a child in this positional setup can better see their toes and their feet. Before 3 months, they kind of aren't even aware that their toes, their feet, their legs are even really in existence. It's more of an out of sight, out of mind situation. So what we'll do is we will rock their hips a little bit onto your chest or your belly, and that optimally places their feet in front of their eyes. You can grab their hands and their feet at the same time and hold their hands over their feet and just play. You can make funny faces or cooing sounds, but how I have my hands positioned over the child is in this fashion, and that makes it quite easy if I want to simply grab hands, clasp them over feet. Okay, so to progress it, you'll bring their hips lower down until they have to do it all by themselves. You can then straighten out your legs further to make it more like they're laying supine on the floor, and they can play with their feet in the same fashion. Eventually, you will get to the point where a child should be able to just bring their own feet up and play independently. At this point in time, more so, you might see a child grab independently foot and bring foot to mouth, but it'll be another couple months before they can grab both feet at the same time independently and play there. So right now, we're primarily just facilitating that. So next we have prone propping on forearms, and so we can position a child down here and we can work on weight shifting. Before this time period, we are more so static, and now we can get into dynamic motions. We can even practice with a toy in front of them and drift it off to the side and up, and that might induce the child's roll. So we can start having roll practice now from a functional position like prone on forearms. From here, we do want to also return to general roll practicing, and you can do this by manipulating the arm and drifting over. You can do it by manipulating the leg, bending up towards the chest, and then leaning over until they're onto their stomach, or you can manipulate the hip and drift over into a roll. By far, I think the leg manipulation is perhaps the most common among providers at this age group, but you can first start with non-segmental rolling, and then you can progress to where the child is rolling from the hips first, and then the shoulder comes over. That's going to be a bit advanced for this age. Right now, we're just guiding them through the motions with various positional setups. So next, we have a swimming activity for the posterior chain. If a child is lying on their stomach and they're lifting their arms up and their legs up, and they're doing so as part of play, that is a typical response for this age, especially if we're using a toy to get their attention and they're trying to reach up for the toy and play with it. However, if your child is doing this so frequently throughout the day, it is starting to become a concern. Likely it's a concern for your physical therapist as well, because it can impact the child's ability to maintain quadruped and to roll as well. So if a constant swimming is present, we do want to reinforce increased amounts of quadruped practice and rolling practice. So how do we go about quadruped? So grab your child in this fashion here. I've got my fingers clamping here, and I can leg sweep, if you will, and position them onto their knees. And then from here, I can hold their bottom and just gently bring them down into an all fours position. From here, we can practice with them on their forearms, or we can have them onto their hands. And if they're on their hands, bear in mind that that is going to be quite more challenging than if they're on their forearms. So weight shifting may or may not be possible on hands, regardless of whether it's possible on forearms. So with the maintained quadruped positioning, if your child still has ATNR, which is if I turn my head one way, my corresponding arms would look like this. So I have a left cervical rotation, my left arm is straightened, my right arm is bent. This can impair feeding, it can impair rolling, and for here, it's going to impair quadruped. So what we want to start practicing a little more fervently is quadruped positioning with simultaneous head rotation. You'll maybe want a second person to have a toy and guide it from the child's left to the right, so they can work on staying upright and not face planting into the ground or their ear hitting the ground if they are rotating to the left and the arm comes out from under them and the other one caves in. So there's quadruped positioning, and the last big exercise series would be sitting. So for the easiest level of sitting, it's the fully supported. I've got my hands under their armpits, wrapping their trunk, and I can progress this in a static position just by slowly coming down lower and lower onto the ribs, and then eventually onto the hips. And to make it a little more challenging in the same setup, if I wanted to have the child on my knees straddling here, I can do a dynamic introduction to where I'm still pretty high up, but I'm just rocking them side to side. I can move my arms to manipulate the child's body positioning, or I can keep my arms where they are, and I can simply go onto my tippy toes and rock the child side to side. If your two knees together are a bit too wide for the child, feel free to just simply have them straddle your thigh. And you want it to be a secure surface, but not something that is causing them to essentially do the splits. You can play around with the placement on the thigh, keeping in mind that bringing them further up the thigh, where your thigh is wider, is going to widen their position and make it a bit of a snugger fit. So you might have to play around with it to find where the child is most comfortable. And again, you can rock side to side. You can even do forwards and backwards by going up and down onto your tippy toes. Rather than lifting your foot in the air, again, it's just easier to go onto tippy toes and lean the child back, and then they're responsible for pulling forward. Or you can even outstretch your leg and tilt them forward, to which they are responsible for pulling backwards using their spinal extensors. Now, we want to, by the 6-month range, eventually get them to where they are sitting by themselves, whether they're at least using their arms to support their weight, or if they are able to play with an object while sitting upright. You can get them to reduce the reliance on using their arms for support by giving them a larger toy that requires them to hold it with both hands. So if you have a ball, for example, you can have them hold that and play with that in space. A larger ball that contacts their thighs will make it a little bit easier, and then giving them a smaller ball that won't contact their thighs might make it a little bit more wobbly and challenging for them to maintain position. But again, sitting should be relatively independent by that 6-month marker. For the dynamic movements of sitting, if you prefer to have the child on a yoga ball or a large inflatable ball, you can definitely do that too and rock them side to side. You can go forward to backwards. You can do diagonals. You can introduce circular motions. Granted, you can do all of these things with your thighs. I can do diagonals here as well. I can do circular patterns, but that is another option, using a yoga ball if you're a little less coordinated with your lower extremities. All right.